So here is your question. Someone got disconnected. Okay, so if you have read and understood, considering it communication skills station, kindly please begin.
Hello, I'm Dr. Ahmed, one of the surgical doctors here in the department. I'm so sorry for you, ma'am, that you have been waiting for so long to see Mr. Ma'am, my consultant. I'm here to help you. Can you tell me what is the problem today?
Yes, first confirm if what is her relation with Mr. X?
Okay, can you please tell me what is your relation to Mr. X, please?
Yes, I'm his wife.
Okay, you're welcome. Can you tell me what is the problem today, Mrs.?
You're not Mr. Mann, right?
No, actually, I'm not Mr. Ma'am. I'm one of the surgical doctors here in the department, and actually, I'm here to help you and to find what is the problem with you and to find a solution. And certainly, I will inform Mr. Mann that you have been here, and also I can arrange an appointment with you with him.
Okay, you said a CT scan is needed. Can you tell me why is it required?
Okay. First of all, I'm so sorry for you and for this tough situation. I already have known that Mr. X has been here a few weeks ago, and he has a tummy swelling, and also he had some, and we have withdrawn some of the fluid present in his tummy, and also it has been sent for cytology, which revealed that the presence with sorrow cancer cells. And yes, for this you have been sent here for the doing a CT, which is a type of scan needed to be done for patients who have this type of tummy swelling and the fluid in their tummy.
Okay. Now, what is your plan? What's the next?
Yes, I already. I'm also sorry for this, but our CT device is not actually working right now. So we can find another alternative for this right now to be done, or we routinely do this CT within 2 weeks frame time.
Okay. Is it enough to do an ultrasound instead of CT scan?
As I told you, there might be an alternatives for the sake of your husband. We might have an ultrasound scan, which is a device use a probe and we put like a jelly on like the jelly used with the probe on pregnant woman. This ultrasound tells us gives us an idea about the amount of fluid presenting in the tummy of your husband, and also it can give us an idea about the liver status, which is an organ presenting in the upper side of your tummy, and it might be the cause actually of this tummy swelling and the fluid. but actually CT is more confirmative. And another alternative is called MRI, which is an type of imaging which is equal for accuracy and function as CT. But we can talk to Mr. Mann to confirm that we have to do any of these alternatives if needed.
So if you're telling that CT scan is needed, why are you delaying? If it's not available, they transfer. If this is a small hospital, please transfer. Why didn't you transfer him from the start?
Yes, ma'am. I'm really sorry for you, and I understand your frustration, and I understand your situation also. Yes, you have a bad condition with your husband, but actually you have to know that I accept that we are a small hospital, but you have to know that this investigation we do it routinely within 2 weeks frame time, and at any time we find that this investigation might not be done, or your husband is in a bad need for this investigation, we can refer him to another hospital to be done. So I don't want you to be an angry or afraid for your husband's sake. We also have to take care of him, and we will not let him to be harmed anywhere.
And how much confirm you are that is a cancer?
Yes, I'm so sorry for this and for this tough situation. But the report presenting from your GP telling us that from the fluid we have withdrawn from your husband tummy, it explains that there is a cancer cell. But actually, we do not know the exact details and full data about this cancer, from where it originates, and what is the stage of this cancer, and what is the possible treatment. So we need to do some further investigations in order to confirm this and know the all data of this cancer.
So do you think that he will ultimately need a surgery for this?
Actually, I do not. I cannot confirm this to you because in some cancers we have to do some surgeries in form of resection of this cancer, but only in the early stages of the cancer, where we are sure that we will remove all the cancer tissue, or the cancer or the cancerous cells, and in your in the patient tummy. But in some advanced cases, the cancer might spread to other sites, so we cannot make a surgery for him, because he might be a little benefit for him. And in the sake of your husband, I'm so sorry, it might be an advanced case because of the fluid, but we have to confirm this by using the further investigations, ma'am.
Okay, but he cannot breathe well right now.
Yes, I'm so sorry for this, and I don't want you to be afraid of this. It's actually due to the presence of the tummy fluid in his tummy, and we can withdraw some of the fluid from his tummy as the previous, and also we can order for him some medications that might decrease the tummy fluid, and all of this will happen after a consultation of Mr. Mann, but will happen very quickly.
Okay. He has a brother. His brother is not here right now. He's traveling. Should I tell him?
I understand your situation, understand your frustration, but I think we can tell him whenever the CT result is available, because there will be a no benefit for him to come and for interruption of him.
You can summarize.
Okay, ma'am, I want to let me summarize to you what we have been through. Your husband have a tummy swelling, which is due to the presence of fluid in his tummy, and he has undergone aspiration of this fluid before, and it reveals with sorrow cancer cells. And your husband is in need for doing a CT, which is an investigation needed for knowing the exact cause and the stage of the cancer and the possible treatment required. Actually, our CT device is in service, and it might be available for the. We do this investigation within 2 weeks frame time, and we have to do another alternatives for this, as I told you, and whenever it is available, we might do the CT, or we might transfer your husband to another hospital in case he is needed. And I want you to know that we are all here to help you and to help your husband, and to give you a hand. And if any time do you have any questions, don't hesitate to contact me, and I will leave my number with the nurse, so you can contact me at any time. And thank you for your understanding.
Good, thank you. Just a few seconds extra. Good, thanks. Right.